Flu season is here and so are the shots. The big question hanging over us all is whether this year's flu vaccine will do a better job than the shot last year when people got hit by the influenza virus even though they had been inoculated. San Diego County's public health officer, Dr. Wilma Wooten, joins me now to give us some answers. First off, what's the forecast for this flu season? Is the virus that's out there expected to be severe, typical, or mild?
Well, we can't answer that question. You can never predict what any given flu season is going to look like until the flu season has actually happened. But as of today, CDC is estimating that the vaccine that is available is well matched to what's circulating in the community. So that's what we can tell you today.
And what is circulating in the community right now?
Well, right now, there's always influenza A. That's been the predominant strain that was circulating last year, H3N2, but there are different variations. And the H3N2 influenza A last year was not well matched to the vaccine. So far this year, but we really won't know in detail until after we get further into the flu season, and CDC has collected specimens from around the country from its sentinel sites to actually know exactly what's circulating in the community. Today we can tell you that the specimens we're getting are the influenza A, that H3N2, similar to what's expected. But that's today. Things could change totally in a week or 2 weeks or over the next few months.
What about H1N1, the swine flu that hit back in 2009, I believe? Then it kind of made a resurgence a couple years ago. Does the flu shot provide coverage for that?
Yes, the flu vaccines, either an injection or nasal spray, has three viral strains included if it's what we call a trivalent, and there are 4 components in the quadrivalent. So it has 2 influenza A's, which includes the H1N1, which is an influenza A type vaccine, and then the H3N2. So 2 influenza A's and 2 influenza B's. Those are the viruses that are expected to be circulating this flu season. But again, as CDC collects specimens from across the country, they will know specifically what's actually circulating.
So who should get a flu shot, or are you pretty much pushing for everyone to get a flu shot?
All individuals that are 6 months of age and older should get a flu vaccination, whether it's a shot or a nasal spray. For nasal sprays, that's approved for individuals, healthy individuals that are 2 years of age to 49 years of age, and women cannot be pregnant for the flu nasal spray.
So some people call flu shots a hoax. They say, look, you know, I get a flu shot and I still get sick. What do you say to them?
Well, the flu vaccine cannot give you the flu. That's a myth. And it's a dead virus in the shots. And in the nasal spray, it's what we call attenuated. So it's not an active or live virus. So they can't give you the flu itself. It takes 2 weeks for both preparations to become effective. So you could be exposed to viruses in that interim. And there are a lot of other viruses that are circulating that can give you flu-like symptoms. So, and people might be exposed to those viruses, so they will become infected. And we must also remember that no vaccine, no matter what it is 100%. However, if you are exposed to the flu after you've been vaccinated, if you get it, your symptoms would be less severe. And another point to remember is the vaccine has certain viruses contained, but there could be other viruses that are circulating that you could be infected with.
So is the county offering flu shots?
We are indeed offering flu vaccinations at our public health centers.
Okay, at reduced prices or free? What exactly is the situation there?
On any given appointment at our public health centers, 1 or more vaccinations, including the flu, is only $10. And if you cannot afford to pay, then you could still be vaccinated.
Okay, one really quick question. I've always had this question. Why do people tend to get the flu in colder weather?
Well, it's thought theoretically that in cold weather, the nasal mucosa is drier. And if it's drier, it's fragile, so the virus can penetrate the nasal mucosa more readily than in the summer months when the nasal mucosa is moist. And so that's the thought behind it. as to why individuals become more infected during the winter months.
Okay,
Yes.
Dr. Wooten, thanks so much for coming on the program.
Pleasure being here. Thank you.